Guys, assalamu alaikum. Hope you are all fine. So today our lecture is based on the lymph node and second part of the lymph node. In the first part of the lymph node, we study about the structure of the lymph node and then cortex of the lymph node. Now we will study about the medulla, because medulla is the last part of the lymph node. So medulla of the lymph node is not too much lengthy as compared to the cortex. Actually, in the medulla you can see here, this is the medulla. The light yellow color mentioned here, this is the medulla. Medulla is divided into two parts. You can see here medullary sinus and medullary cord. In the medulla, the lymph node, the tubercle become highly vascular. As you can see here, it is highly vascular and branch, and it is finally fused with the connective tissue of the hilum. You can see here, this is fused with the connective tissue of the hilum, as you can see here. Medullary lymph tissue is arranged chiefly in form of the irregular anastomose cord, which is called medullary cord. As you can see here, this is the medullary cord, and the space between, you can see here, this is the space between the medullary cord is known as medullary sinus. In the medulla, the cord of the medulla consists of B lymphocytes and plasma cells having in a network of the reticular fiber and reticular cells. Some of the medullary cord are continuous with the lower pole of the cortical nodule, as you can see here, continue with the lower pole of the cortical nodule, but no lymphatic nodules are present in the medulla. This is the important point. The antibody is produced by the plasma cell of the medullary cord, because the plasma cell and B lymphocyte are present in the medullary cord, which is so antibodies produced in the medullary cord. These antibody from medullary cord pass into the medullary sinus, and from medullary sinus it move toward the afferent lymphatic vessel and finally reach the general circulation. So this is the small discussion about the medulla of the lymph node. Now we will talk about the role of the lymph node and role of the lymph node in the immune system. So first question is that what is the role of the lymph node in the what is the role of the lymph node? Actually, lymph nodes serve as a immunological filter, and one of their chief function is to remove bacteria and the foreign material from the lymph. We simply say that lymph node is act like a filter. It just filter the lymph. If any microorganism and antigen present in the lymph, it just filter the lymph and clean the all bacteria and antigen from the lymph. Now the second question is that what is the role of the lymph node in the immune response? So dendritic cell, which is located in the skin, and mucous membrane, capture the antigen and migrate to the lymph vessel to the lymph node and present their epitope MHC12 complex to the helper T cell. MHC2 is just like a identity card which they mention to the T lymphocyte in the paracortical region. In the previous lecture we discussed about the paracortical region. This is the light purple or we say light, just like a light blue color. This is the paracortex, this is the nodular cortex, this is the paracortex. Paracortex do not contain any nodule. T lymphocyte in the paracortex region of the lymph node. If the helper T cells of the paracortex become activated, they divide mitotically to produce more helper T cells. Then these helper T cells pass into the medulla. These helper T cells from paracortex pass into the medulla, and then from medulla, in medulla, which is divided into two parts, the medullary cord and medullary sinus, it passes into the medullary cord, and then from medullary sinus and finally to the afferent lymphatic vessel, and then reach finally to the germinal circulation. As the lymph from the body is finally drained into the the new form helper T lymphocyte pass into the medulla, and finally leave the lymph node to the afferent lymphatic vessel. As the lymph from the blood body is finally drained into the blood, the helper T lymphocyte travel in the blood and ultimately reach the area of antigenic activity to neutralize the antigen. So this is the role of the lymph node in the immune response. One another question is that why lymph node is enlarged in the infected area. The answer is so simple, and it is that lymph node drain and affected area become enlarged because of the formation of germinal center. In the okay, you can see here in the nodular cortex, it consists of two types, primary and secondary. If primary do not contain any germinal center, but the secondary contain germinal center, it must remember. Germinal, so produce germinal center and proliferation of T lymphocyte in the lymphoid nodule. Such lymph node usually appear as a painful swelling in the neck, axilla or other region of the body. In the event of development of malignant tumor in the body part, the cancer cells may break off from the primary tumor and enter the lymph vessels and then metastasize to the nearby lymph node. The cancerous cell may continue to grow within the lymph node as this node maybe continue to the lymph node at secondary tumor and produce painless enlargement of this node. Presence of metastatic cancer cell in the lymph node is used by the surgeon and pathologist as one of the most important deciding factor in the cancer staging system and in estimating the prognosis of the disease. So due to this reason, the lymph node is enlarged. Hope you can understand. So this is the small discussion about the medulla and some answer discussion. Hope you can understand. Okay, thanks for watching.